provided through the Thriving Texas Families program.
Chair recognizes Ms. Hall.
Thank you, Mr. Speaker. This bill streamlines the process for Thriving Texas Families contractors to receive payment by creating a single form with specific information to help measure outcomes more effectively and determine any gaps in services for pregnant moms to better allocate resources and support pregnancy in Texas.
Mr. Speaker?
Ms. Howard, for what purpose?
Yes, would the lady yield?
Will the lady yield
Yes.
for questions? The lady yields.
Thank you, Representative Hall. I very much appreciate your effort here to get more transparency. I think that's really important that we understand how this program is working, what the outcomes are, to know that this is we're being good stewards of the state dollars here. I do have a couple of questions. I'm looking at your bill and what you just laid out about a form.
Another form bill.
Well, that's
Yeah.
okay. Sometimes we have to have those.
Yes.
But your form basically is looking at clients, unduplicated clients, each interaction that those unduplicated clients had, the employee who provided the service, and an itemized list of the services, whether it was a referral, that sort of thing. Is that correct?
Yes.
That's the information that you're gathering.
Yes.
And what do you expect to find out from that information?
To see where the gaps are and all the services and everything that's being provided, to see where the gaps are, where we can better provide support.
So in other words, to see where the gaps are in terms of what services people are receiving.
Yes. Yes.
So one of my concerns about how we've been looking at the metrics of this program, and I feel like we're moving in the right direction, I appreciate what you're doing here, is that we're itemizing and listing things, but we're not looking at outcomes. And if I look at the Thriving Texas Families website at HHSC, it gives a whole list of things that we're supposed to be accomplishing with this program: promoting healthy pregnancy and childbirth, promoting childbirth as an alternative to abortion, even though abortion is no longer legal in our state, increasing access to resources, that I think this does, encouraging family formation, helping parents establish and implement successful parenting techniques, increasing number of families who achieve economic self-sufficiency, and there's more. But just to take that last one, families who achieve economic self-sufficiency, is there anything in your bill or what you're proposing here that would actually give us the information to know if we are achieving that goal, if there's a metric we can use to suggest that these families are actually achieving economic self-sufficiency?
I think the goal is, again, to collect the information on all of the services and what is being provided. So to achieve what you're talking about, I don't know that example, a pamphlet is going to do enough. So was it a pamphlet just given? Was a service actually provided? So trying to figure out what all is being done, what all the services are. And I think based on that, knowing what all those services are, what was being provided for these women, we will then be able to know some of these moving in the right direction of more transparency with the outcomes, and again, to be able to better serve these women.
And I appreciate what you're saying. And again, as you point out, the fact that they're receiving a pamphlet does not necessarily indicate that we're achieving something other than handing out a pamphlet that hopefully will be read and informs people. But in terms of actually having real metrics that show us that we're achieving the stated goals of the program, I'm still concerned about that not being present here. You know that in the biannual reports, I guess, that comes out from this program, that it indicates that the majority of services that are currently provided through TTF are education materials and so-called counseling services, but the state does not require that these services be delivered by licensed professionals. Were you aware of that?
I am not advised. But I do know that there's even things like clothes and diapers. There's
Right.
a lot of parenting classes. I have visited some of these
Right.
places in my district, and they do incredible work.
Would you be open to an amendment that would provide some clarity regarding the types of providers who are allowed to be reimbursed for services? Excuse me?
I'm sorry, will you repeat that question?
Sure. Would you be open to an amendment that would provide some clarity regarding the types of providers who are allowed to be reimbursed for services, or can anyone be reimbursed for services?
I don't think that's necessary at this time. I think gathering this information will help us move in the right direction, again, to know where gaps are. I know that a lot of these services and facilities are already tied to medical providers. They're the ones providing these services, so I don't think that that is necessary at this time.
But you do, I think, from what you've said, think it's important that we know that this program is actually achieving the goals that it intends to achieve.
Yes, and I think that this helps to do that. I think this bill helps to achieve that goal, to make sure that all the resources are going to the correct services and to the right places. And I think when we talk about in this bill, looking at the provider who is doing the service, what service that is, I think that helps us gather all of that information.
And you are aware that there are no medical services provided by Thriving Texas Families, correct? You know that?
Yes.
Yeah. So these are services that don't have anything to do with health care, medical services. These are, as you point out,
Yes.
educational information, pamphlets, classes, handing out
usually
diapers.
Yes, but usually it's in the same facility, so they will go to the clinic to
in
have
the same facility as what?
as where they are receiving their medical services, all of their prenatal care, their ultrasounds, their checkups, and in those same clinics, then they will do parenting classes. They can go get diapers, they can go get clothes, all within the same facility.
Thank you. We all have our assistants coming around. I have visited before as well, and there is not necessarily, though, these programs will be housed where medical services are provided, but Thriving Texas Families provides no medical services and may not be reimbursed for any medical services. Is that not correct?
I do understand that, yes. But
Yeah.
I'm saying in those facilities is where some of these services take place, and I have met with some of these counselors who offer these classes and offer these counseling services. And I've gone and I have donated diapers to some of these facilities and seen the baby clothes that they give out and the car seats and all of those things.
Well, what I would, if you're not interested in the amendment that I have here is a statement indicating whether the service provider operates a crisis pregnancy center. Would you be amenable to that being a part?
I don't think it's necessary at this time.
I would really like to continue to work with you on this because I believe that we have a lot of concerns out there about misinformation, about a lack of real accountability, about a lack of clear metrics, and I do appreciate what you're trying to accomplish here. But at the same time, I don't think that there's anything that's presented in this bill that gives me any kind of comfort that these goals are actually being achieved. It's still doing more of just a counting of number of pamphlets and the counting of the number of so-called counseling without having any kind of specifications about what that counseling includes, and no indication whatsoever that indicates that they've achieved economic self-sufficiency, that they have encouraged family formation, whatever that means. How do we know that they've done that? That they've had a healthy pregnancy and childbirth. We don't collect any data to indicate that the people who are part of the counseling of this program end up with healthy pregnancies and childbirths because we're not collecting that information. So I do agree with what you're trying to accomplish here in terms of being more transparent and getting the data that we need for this program, but I don't believe that what is in this bill is going to give us the information we need to truly understand what the outcomes are and how successful this program is, other than having an accounting of how many people came through the doors, how many pamphlets were given out, how many diapers were given out, that sort of thing.
Yeah. Well, again, I think when my bill says an itemized list of each service, and it goes on, but I think that will help with again, just the understanding of all of the services that are provided. So I hear what you're saying. Happy to keep working on this, but again, at this time, I think the amendments are not necessary on this bill.
Thank you.
Thank you.
Mr. Speaker,
Ms. Gonzalez, for what purpose?
does the gentlelady yield?
The lady
Yes.
yields. Questions. The lady yields.
Thank you. So how how will the new standardized form be monitored or audited to ensure compliance and data accuracy?
I'm sorry, will you repeat that again?
Sure. I said, how will this new standardized form be monitored or audited to ensure compliance and data accuracy? And I know that was you and Donna, or you and Representative Howard were talking a little bit to that, but I'm just curious to know.
Yeah, are you talking about through the commission, through HHSC, or
Or just the
What are you talking about?
The data that's going to be entered in this new
they
form.
turn it in for payment? So this is to standardize a form to, so when they turn that in, they have to turn this in so they can get the payment on these services. So I think that's, yes, right, through HHSC. So that's, I think, that's
Gotcha.
kind of an audit right there.
Okay. Does a bill require any evaluation of whether the services being provided are effective in improving maternal health care outcomes?
What was the first part of your
I
question?
said, does a bill require any evaluation as to whether the services that are being provided are effective in improving maternal and infant health care outcomes?
The goal, again, is to collect what services are happening so we have more information. So I would say yes.
Okay, thank you.
Thank you. Move passage.
Question occurs on passage to engrossment of House Bill 2581. This is a record vote. The clerk will ring the bell. Show Ms. Jolanda Jones voting nay. Show Mr. Louderback voting aye. Show Mr. Hayes voting aye. Show Mr. Alders voting aye. Show Mr. Morgan voting aye. Have all voted. There being 94 ayes, 39 nays, House Bill 2581 is passed to engrossment. Please excuse Mr. Guerin because of important business on a motion of Mr.